The presynaptic neuromuscular nerve ending contains membranous vesicles prepared to release its stored neurotransmitter acetylcholine. Neuronal stimulation initiates a cascade of events that leads to the fusion of the neurotransmitter-containing vesicle with the nerve membrane. This process is facilitated by a group of proteins comprising the snare complex. The membrane fusion results in the release of acetylcholine into the synaptic cleft by a process of exocytosis. The acetylcholine diffuses and eventually binds to receptors on the muscle, leading to muscle contraction. Botox, onabotulinum toxin A, consists of a heavy chain of 100 kilodalton and a light chain of 50 kilodalton, making up the 150 kilodalton core type A molecule. The toxin is protected by accessory hemagglutinin and non-toxic non-hemagglutinin proteins, yielding a uniform 900 kilodalton complex. This illustration shows a cross-section of the spine, with a motor neuron extending into the muscle and a sensory neuron extending out of the muscle. After injection of Botox, it would be expected that most of the neurotoxin would remain at the injection site. The Botox core molecule dissociates from the accessory proteins and targets the nerve endings. The binding domain of the Botox core muscle is the C-terminal protein of the heavy chain with an acceptor on the nerve. The Botox core molecule enters the nerve cell by a process of receptor-mediated endocytosis. It is the heavy chain that contains the binding domain. The toxin is now contained in a membranous vesicle inside the cell. Soon after, the light chain is released into the cytoplasm of the nerve terminal, where it begins to cleave one of the snare proteins. In motor neurons, the light chain of the Botox core molecule blocks the release of acetylcholine by cleaving SNAP25, which is an essential component of the snare complex. When acetylcholine cannot be released, muscle contraction cannot occur. In sensory neurons, the light chain is believed to cleave SNAP25 by a similar mechanism, thereby blocking the release of neuropeptide neurotransmitters and inhibiting the sensitization of pain nerves. The toxin does not appear to affect the conduction of electrical signals along the nerve fiber or the synthesis or storage of acetylcholine.
Indications. Botox is a prescription medicine that is injected into muscles and used to treat the abnormal head position and neck pain that happens with cervical dystonia or CD in adults, and to treat certain types of eye muscle problems, strabismus, or abnormal spasm of the eyelids, blepharospasm, in people 12 years and older. Important safety information. Botox may cause serious side effects that can be life-threatening. Call your doctor or get medical help right away if you have any of these problems after treatment with Botox. Problems swallowing, speaking, or breathing. These problems can happen hours to weeks after an injection of Botox, usually because the muscles that you use to breathe and swallow can become weak after the injection. Death can happen as a complication if you have severe problems with swallowing or breathing after treatment with Botox. Swallowing problems may last for several months. People who already have swallowing or breathing problems before receiving Botox have the highest risk of getting these problems. Spread of toxin effects. In some cases, the effective botulinum toxin may affect areas of the body away from the injection site and cause symptoms of a serious condition called botulism. The symptoms of botulism include loss of strength and muscle weakness all over the body, double vision, blurred vision and drooping eyelids, hoarseness or change or loss of voice, also known as dysphonia, trouble saying words clearly, dysarthria, loss of bladder control, trouble breathing, and trouble swallowing. These symptoms can happen hours to weeks after you receive an injection of Botox. These problems could make it unsafe for you to drive a car or do other activities that may be dangerous. Refer to the section in the medication guide entitled, "What Should I Avoid While Receiving Botox?" There has not been a confirmed serious case of spread of toxin effect away from the injection site when Botox has been used at the recommended dose to treat severe underarm sweating, blepharospasm, or strabismus, or when Botox Cosmetic has been used at the recommended dose to treat frown lines. Tell your doctor about all your medical conditions, including if you have a disease that affects your muscles and nerves, such as amyotrophic lateral sclerosis, or ALS, or Lou Gehrig's disease, myasthenia gravis, or Lambert-Eaton syndrome. Tell your doctor about all the medicines you take, including prescription and non-prescription medicines, vitamins, and herbal products. Botox can cause serious side effects. Other side effects of Botox include dry mouth, discomfort or pain at the injection site, tiredness, headache, neck pain, and eye problems, double vision, blurred vision, decreased eyesight, drooping eyelids, swelling of your eyelids, and dry eyes. Symptoms of an allergic reaction to Botox may include itching, rash, red itchy welts, wheezing, asthma symptoms, or dizziness or feeling faint. Tell your doctor or get medical help right away if you are wheezing or have asthma symptoms, or if you become dizzy or faint. Tell your doctor if you have any side effect that bothers you or does not go away. These are not all the possible side effects of Botox. For more information, ask your doctor or pharmacist. For additional information, refer to the medication guide. The medication guide summarizes the most important information about Botox. If you would like more information, talk with your doctor. Please click on the link for full product information, including the medication guide.